Hi. Nowadays, many couples have to resort to IVF treatment for getting pregnant. A lot of celebrities are also getting pregnant through IVF. You must have heard about it. So, have you ever wondered what exactly does this IVF mean? How is this treatment done? And who are the couples who need this treatment? Let's know more about IVF today in this video. But for this, you'll have to watch the complete video. Hi, I'm Dr. Manjushri Kothekar. I'm a fertility and IVF specialist and I practice as a senior IVF consultant at Art Fertility Clinics, Mumbai. And I run this YouTube channel where I put such videos on such small topics. So if you are not yet subscribed my video, don't delay. Just push the subscribe button. So for you to understand how IVF works, you need to first understand the natural physiology, how conception happens. So for a conception to happen, we need one egg and one sperm. The egg comes from female body and the sperm comes from the male body. A female has a uterus in her body. There are two fallopian tubes besides the uterus and there are two ovaries besides the uterus also on either side. So these ovaries contain follicles and these follicles contain eggs. So every woman is born with a certain number of follicles and out of that follicle pool, one follicle will start growing every menstrual cycle because of her internal hormones. So once the follicle reaches around 18 or 20 in size, it ruptures and the egg inside is released and it is captured by the fallopian tube. So the tube gives passage for that egg and the egg waits there for 24 hours. Within that 24-hour window, if a sperm is able to reach that egg and fertilize the egg, they'll fuse together and they'll form the embryo. This embryo grows from day 1, day 2, day 3, day 4, day 5 and it enters from the tube to the uterus and it sticks to the uterus, inner layer of the uterus, which is called as endometrium. This process is called as implantation and this is how a pregnancy happens naturally. In vitro fertilization or IVF means the process of fertilization is being done in vitro. In vitro means outside human body. In vivo means inside human body. So we are replicating the same process of fertilization but outside in a lab. How do we do it? For that we'll need egg and sperms. So we grow your eggs by giving some injections, hormonal injections. We grow your follicles around 9 to 10 days of injections. Then we do a needle puncture under anesthesia wherein we remove the follicular fluid. That fluid contains eggs. Then we see how many eggs are there. Suppose we get 9 or 10 eggs. We select those many sperms from your husband's semen sample and one egg is fused with one sperm. Either we do it by ICSI, which is called as intracytoplasmic sperm injection, which is a mechanical process of fertilization, or we can do the job, we can let the eggs and sperm do the job themselves. That is called as in vitro fertilization, wherein we just keep the eggs and sperms together, we culture them together so that they will fuse together naturally. And then we let the embryo grow and then either that embryo is frozen or transferred inside your uterus. So this is in a nutshell how IVF is done. Now let's understand which are the couples who will need this treatment for conception. So couples where the tubes are blocked, where there is no passage for the eggs or sperms to fuse together. Couples where the egg reserve is very low. The female age is little bit on a higher side and that is why the number of eggs, number of follicles remaining is very low. Low egg reserve patients. Where the sperm count is low, the sperm are naturally not able to go and fertilize the egg. And sometimes some cases of unexplained infertility, they had tried everything, every other treatment, but it has failed. That means they'll need something more for getting conceived and those couples also will need IVF. So that's all for today. If you have any more doubts, you can put a question here in the comment box and suggest me the next topic for a video in the comment box. Bye bye.